Hello, this is Kristen Culver. I am hosting the BNI Commerce Connection Wellness Sphere virtual speaker series, and I wanted to introduce to you our next presenter, Dr. Chen. He is a graduate of the New England School of Acupuncture, now part of the Massachusetts College of Pharmacy and Health Sciences. With a master's degree in acupuncture and oriental medicine, along with being a licensed acupuncturist and certified Chinese herbalist. He is also a diplomat in oriental medicine from the National Certification Commission for Acupuncture and Oriental Medicine. Chen has been practicing acupuncture for over 10 years. In 2014, Chen started his own acupuncture clinic, Bamboo Wisdom Acupuncture in Wells. His office offers services for acupuncture, therapy, pediatric acupuncture, and Chinese herbal consultation. Chen has specialized training in a number of areas, including the treatment of pain, stress, and women's health. Committed to ongoing education and training, he has specifically studied pediatric acupuncture and the treatment of infertility, sports injuries, diabetes, autoimmune disease, and mental health, with Oriental Medicine, Masters in Massachusetts, California, New York, China, and Japan. Chen brings results-oriented approach to practice of acupuncture. He uses his knowledge and experience to provide each of the clients he works with personalized, tailored treatment that addresses the concerns and promotes their overall health and well-being. With impressive scholarly credentials, Chen prides himself on extensive practical experience and his caring, compassionate manner. I'd like to present to you Dr. Chen. Screen share.
I'm offering acupuncture therapy and the pediatric acupuncture therapy and herbal consultant. Acupuncture is to stimulate the surface of the skin to stim and to regulate energy flow in your body, so the help body to improve their balance and reach the health. I can first the signal allergy. Acupuncture can help body to strengthen their respiratory function to reduce the allergy symptom. It's the first one. The second one, the infertility also very good in acupuncture therapy because they can regulate the hormones to help the women to have the baby, also keep the baby, and also make the baby healthy. And the third one, acupuncture is also good for the post-cancer care patient because acupuncture can reduce the side effect of chemotherapy or other radiology therapy or immune therapies treatment in cancer patients.
Hi, I'm Chen, a licensed acupuncturist and a certified Chinese herbalist. Most search topic on Google is how to improve immune system during the COVID-19 pandemic. The pandemic is still going on. Public health officers advise us to follow certain actions, such as social distance, washing hands, and wearing masks. These actions will protect the health of families and the communities, but many people are concerned about how to improve their own immune system. I will discuss this topic from a holistic perspective.
How do you strengthen your immune system? I would like to introduce two concepts. The first one is blood circulation. Our blood delivers nutrients and oxygen to cells and tissues. Our blood also eliminates metabolic wastes from cells and tissues. Good blood circulation will keep cells and tissues healthy, so our organs will work well. How do we maintain good blood circulation? Our body is a heat engine. The heart and the blood vessels need heat energy to keep blood flowing. People with good blood circulation in their hands and feet are nice and warm. The second concept is heat. Heat is related to our body temperature. Our normal body temperature is between 97 to 99 Fahrenheit. Low body temperature means low heat and poor blood circulation. Poor body circulation affects the body's ability to heal. For example, people who have cold feet usually have sleeping problems. Women who feel cold on the lower abdomen and hip usually have painful periods. A cold abdomen and hip are very common in infertility patients. Regarding immunity, a low body temperature will suppress our immune system. Research shows our T cells, which are very important immune system cells, will reduce mobility with the low body temperature. Our T cells can recognize and eliminate the virus-infected cells. The low mobility of T cells slow down our body to defend pathogens. Therefore, good blood circulation and a nice warm body temperature are the two key points to strengthen our immune system. How do we maintain good blood circulation and a nice warm body temperature? Traditional Chinese medicine, such as acupuncture and the Chinese herbs, can help. I would like to introduce a special and unique exercise to help everyone. You can practice this exercise at home. This unique exercise is created by my teacher, Mr. Gu. Mr. Gu integrates traditional Chinese medicine, Taoism, energy art, and Western anatomy to develop it. When we are doing something very physical, such as playing sport or working out at the gym, our body heat goes up and we sweat a lot. After sweating, our body starts to cool down, so our body heat cannot last long. Mr. Gu's unique exercise can make body feel warm in a short period of time, and the body will only sweat slightly, so the heat will last longer. Mr. Gu's exercise causes the body to produce a comfortable heat wave to promote blood circulation. It not only keeps the cells healthy, but also reduce any cholesterol accumulation in the blood cells and maintain blood cells flexibility. I have given the exercise the nickname blood vessel sweeper. Moreover, Mr. Gu's exercise can target organs which will improve circulation. For example, women with a cold abdomen and hip tend to have delayed period and dysmenorrhea, which means painful periods. There is poor circulation around ovary area and other related endocrine glands. By practicing Mr. Gu's pelvic exercise, you will notice increased blood circulation in the pelvic and the lower abdomen area to nourish ovary. Healthy ovaries will help balance hormone and regulate periods. I also suggest and apply Mr. Gu's pelvic exercise to help infertility patients. Regarding immunity, T cells are an essential part of immune system. Our thymus produces T cells. Thymus is in the upper chest between two lungs. As we age, the thymus degenerates, becomes smaller and less able to produce T cells necessary to fight infection. After the age of 60, we only make a few or no new T cells. This is one of the main reasons that senior people have low immunity. By practicing Mr. Gu's T cell exercise, it could improve blood circulation around thymus area to slow down thymus degenerate. It can help strengthen the immune system. I'm going to demonstrate 3 simple moves of T cell exercise.
The first move, in the beginning, steadily run your back. Lift your right leg up. Place your right arm in front of your chest. Next, drop your foot to the floor. Push your arm forward and upward. meantime, stretch spine, head up to the sky, and tuck your chin. We do the move for 30 seconds. After 30 seconds, let's do it again on the left side. We do the move for 30 seconds. This is the first move. The second move, in the beginning, make a fist on both hands. Next, drop fist on top your thigh. In the meantime, stretch your spine, head up to the sky, and tuck your chin. Gradually, we can sit up, tapping on the thigh. We do the move for 30 seconds. This is the second move. The third move, in the beginning, find a sore spot in the upper sternum below the clavicle bone. Next, use the base of thumb to tap on this sore spot. We can tap fast or slow. We tap hard or gentle to stimulate our thymus. Next, cross two hands and press on this spot, bouncing spine up and down. Do this move for 30 seconds. Imagine there's energy coming from your hands and entering your thymus. This is the third move.
If you feel that your body is warm during or after doing these moves, especially on the face or feet, it means you are starting to benefit from Mr. Ku's exercise to promote blood circulation. I taught T-cell exercise to COVID-19 patients to help them recover from illness. Patients feel different now doing T-cell exercise. The patients who are doing this exercise have more energy, less chest tightness, and less anxious after practicing the T-cell exercise daily for 2 weeks. If you are interested in learning more about T-cell exercise, the pelvic exercise, or endocrine exercise, please contact me. If you like my video, please like, share, and subscribe to my channel. Thank you for watching my video. Yes.
Now, are you having a particular fall allergies? I know that's always a pretty common one at this time of year.
Yeah, it's allergy season right now.
Do you have, now I know you talked a little in your video, but I can't quite remember. Can you treat COVID symptoms since it is sort of a respiratory sinus thing?
Yeah, the COVID, usually we use tailor medicine or the video to treat, because there's no medication right now. So when only
So none of the acupuncture or herbs would help?
Yeah, that's what we use herb to help. That's why in China right now we use herb because because they use antibiotics for the malaria, antibiotics, and some medication. Yeah, that's why we use herb to help. Yes, that's what we.
So that's why you were talking so much about strengthening the immune system. I get it now.
Yeah, and some people, even no medication or a few, they use this exercise to reduce, we call the immune storm. They call the lung happens better, so don't need the ventilator. That's why we treat the way, and also I'm treating a COVID patient right now. Last Saturday, the mother called me, the son and the grandson, they forget it. Right, and
so are you doing video sessions with them, like telemedicine?
Actually, it's a telemedicine, but it's video, video things.
Okay.
Telemedicine, but this telemedicine is a video.
So I teach them do the consultation and teach them the exercise, and so they can do. And so far they are volunteering right now, and the symptoms reduce a lot. No fever. So far no fever, but still body achy. Yeah, but
That's good to hear.
yeah, good to hear. Hope they know. It's because Saturdays the husband doesn't know, the son doesn't know until he got because in his working place is a state government. They need to do. They test is positive, and then 3 days later, all these things come up. That means one week he already get it. Yeah, yeah. So this is he has 2 children, and a week before he has a family visit his parents, so his parents was very nervous. Yeah.
Are you finding you're getting referrals to people outside of Massachusetts right now?
Some, but there is from the telemedicine use video one to prescribe what herb, but not many, not many.
Well, I wasn't sure because I know you're obviously, licensed as a doctor in Massachusetts. I did not know if your training permitted you to practice in other states, because video conferencing, you could technically be talking to someone if they're not a resident of Massachusetts, I should clarify. If they're visiting family and they're quarantined because they got sick where they're at and can't come home.
Yeah, true. And also, if the exercise in the herb, you don't need a license. Almost all states.
Okay.
But
so if someone was traveling, and even if they didn't get sick, they're just with their family and can't leave because they're out of state.
Yeah.
But like they have some other issue that you can treat. You can still talk to them. You can still mail them out a treatment, and they can apply it appropriately. Yeah. Okay, good to know. I wasn't sure how that worked, because I know doctors sometimes have limitations on where they can practice.
Yeah. Because it's the herb, most of the states they treat herb. They see herb as a supplement, so you don't need license, and also
kind of like a vitamin.
Yeah. The same thing. So if the medical doctor, there you need license state. Yeah. Yes.
Wanted to thank you for watching, and just take one moment briefly to share my own personal testimonial. I will admit, full disclosure, I have been a patient of Dr. Chen. I had really, really, really bad migraines. I'd gone through, several various medication types. Zomig, Maxalt, you name it, everything that's out there. I wasn't taking it every day. I was taking it as needed, because I would get that migraine once a month, once every couple months. That was so painful. It felt like someone was trying to crush me with a ton truck. It was not the kind of thing I could predict. And sometimes it was the kind of day it was. If it was hot, if I was under stress, I hadn't eaten anything, obvious things. But when it was just completely unpredictable, I knew that I could call him and he would fit me in for a very brief session. And then we got smart and realized they're reoccurring. So I set up a series of appointments. And after about 6 sessions, I think they were spread out every couple weeks, I really started to feel relief. No longer was the pounding sensation like someone driving a large railroad tie through my head. It was months and then years before I had a migraine again. Now, maybe some of that was diet, rest, and drinking water, and reducing stress. But I will say, if I hadn't continued to see Dr. Chen periodically over 6 years' time, I probably would be suffering from migraines significantly even now. One time, I think under COVID-19 stresses, I got to the point where I needed to see him. And he took the appropriate measures to walk me through on a video session some things that I could do. I can't recall, but it looks like some of the exercises he showed were some of the same ones I did. And what it did was it warmed my body up. I'm hypothyroid. I am always cold. I have poor circulation. And oftentimes, when your blood can't flow correctly, or I'm not a doctor, but I think your energy can't flow correctly, that's when things happen. And in doing what he did to help me kind of get things flowing, it released the tension. My headache went away. And when it's safe to do so, I'll be able to go back to his office for a follow-up session. He was very good about answering my questions in the email. It was very easy to schedule an appointment on his website. Dr. Chen is so pleasant, always a smile, sometimes a joke. You don't feel uncomfortable going to the doctor's office when you go see Dr. Chen. You know you get taken care of. And he will make sure if the treatment isn't working, he'll ask what's going on. Sometimes it's the Chinese herbs, sometimes it's cupping, sometimes it's acupuncture. And you might have heard him mention infant acupuncture. It's actually a very smooth, rounded metal tip that he presses gently on the baby. No needles. So if you were like me and afraid of needles and didn't want to go to an acupuncturist just for that reason alone, know he has alternative options. Eastern medicine is legitimate, and I feel like it is the wave of the future. People need to consider it because sometimes you take a medication and the side effects are worse than the problem you're having. I like to think that Dr. Chen is onto something, and I'm glad he's in Wellesley taking care of our health. See you next time.